Well, imagine beating cancer twice, but then almost dying from an infection. It happened to a Houston man, and doctors say stories like this are not rare. KHOU takes an in-depth look at superbugs and how healthcare professionals are sounding the alarm on a growing resistance to antibiotics.
Roger Pelzer is a survivor. He beat lung cancer once.
Probably have run my last marathon, but that's okay.
Then, when a different type of cancer struck his other lung, he beat it again.
I get tired. I'm missing a couple of pieces of each lung.
But it was a bacterial infection that almost killed him during that second hospital stay. Roger doesn't remember a lot of what happened at the time, but his wife Marcia does.
It's Pseudomonas, which I had never heard of. I was expecting to hear MRSA, strep. I went home and Googled it, and then I went, oh my God.
Doctors began treating Roger's Pseudomonas with aggressive doses of antibiotics.
It would hold the infection at bay, and he would appear to improve for 3 or 4 days and then become resistant and right back on the respirator. They told me that he would eventually die.
A Pseudomonas is one of our worst organisms for mutating and becoming resistant during therapy.
Dr. Barbara Murray with UT Health says antibiotic resistance is not a problem, it's a public health crisis. Bacteria no longer respond to drugs designed to kill them, and that means infections and diseases become harder to treat and more deadly. The CDC says every year more than 2 million people in the U.S. fall victim to antibiotic-resistant infections, or superbugs, and more than 23,000 deaths are attributed to these infections. Thankfully, Roger wasn't one of them. After 4 months and almost a dozen different antibiotics, one worked.
They came in, and when I saw that bag go up, I thought, this is it. This is going to work. That was like winning the lottery.
Why is there a growing resistance to antibiotics? For one, they're overprescribed. They're used in food-producing animals. And they're added to things like soap, clothing, even toys. And all of these factors scare the medical community. That's because antibiotics are a limited resource, and drug companies aren't motivated to create new ones as the need grows.
I've got a Viagra, or I've got a diabetes medicine, or I've got a high blood pressure medicine, and patients are going to want to take this the rest of their lives. So the CEO answers to stockholders. They don't answer to the public good.
Recently, the Infectious Diseases Society of America featured Roger's story along with several others in a report titled Faces of Antimicrobial Resistance to shed light on the problem. And Roger and Marcia say they support any efforts to help stop or curb the spread of resistant infections.
And that's the motivation. That's why I'm certainly willing to share. Others worked hard for me, and I'm just trying to give back.
So what can you do? Well, first, don't pressure your physician to prescribe antibiotics unless there is a real need. Also, avoid household products that contain them as a way to enhance health. And finally, don't buy meat or poultry that contains antibiotics. Rekha, KHOU 11 News.
A link to the full report from the Infectious Diseases Society of America is available on our website at khou.com.